So then good food deficiency. So if you're not consuming whole fruits and vegetables, if you consume lots of grains and processed foods, if less than 80% of the food you consume is organic, and if you consume dairy, gluten, corn, sugar, or alcohol every 1 to 2 days, then you've got a good food deficiency. You're not getting the food that you need. In fact, you're getting a lot of toxic foods. So what we're going to do for testing here is the Great Plains Tox Lab, which is going to look for chemical toxicities, including pesticides. And then I have also the information here on how to provoke it, how to use liposomal glutathione to push the chemicals out of its hiding places so that then you collect it in the urine with this test, and we can make sure that we get an accurate sample. And then the glyphosate, which is basically the active component in Roundup. So we're looking for pesticides, the pesticide toxicity for food toxicity. And this also needs to be provoked with the liposomal glutathione. And then if the urine test shows pesticides, that is significant. And then I say it's my experience and very likely that if someone has a good food, someone has a good food deficiency or food toxicity if they have 2 or more of the above symptoms. So the labs can definitely be helpful, but if you're not consuming a lot of your stuff organic, there's been studies to show that it just comes out in the urine. They've done before and after testing, taking kids, and they were actually looking at behaviors, and they found that in children who were not eating an organic diet, they found pesticides in their urine, and their behaviors were not supportive of the environment that they were in, so they were poorly behaved. And then when they switched to organic for 3 months, they found that there was no pesticides in the urine and the kids were much better behaved. So very important, but you can tell based off signs and symptoms, and then you're complemented with the laboratory testing.